change begins with immediately repealing and replacing the disaster known as ObamaCare. With ObamaCare, premiums are surging, companies are leaving, insurers are fleeing, doctors are quitting, and deductibles are going right through the roof. We can repeal and replace Obamacare and save health care for every family in Michigan and throughout the United States of America. We have to do it.
All right, that is now President-elect Donald Trump on the campaign trail earlier this week, promising to repeal and replace Obamacare. Now, this is an issue that has been weighing on the minds of many of the American people. Now, after it was announced, of course, that Obamacare premiums will once again skyrocket this coming year, many people will be seeing double-digit increases. So how will the president-elect, when he becomes president, repeal and replace it? Joining us now, former 2016 presidential candidate, Dr. Benjamin Carson. Dr. Carson, I read that you have been asked to be a part of this effort to repeal it and replace it. True?
Of course. And of course I would be extraordinarily happy to help with this. You know, health care is by far the most important thing that a person has. And, you know, this announcement of this big increase, this is just the first tranche. There's going to be several more. It's going to be completely unaffordable. It doesn't work. I think the people who put it together knew that it wouldn't work and that it would prime the people for acceptance of government-controlled single-payer system.
So how do we transition?
Fortunately, we've stopped that.
All right, so we're going to repeal it. How do you transition people back to it? How do you create free market health savings accounts with competition, with portability that allows for pre-existing conditions? This is not an easy task. Undoing this damage is going to be hard. Are you worried about transitional costs for people?
It's not an easy task, but, you know, we have models for how to do it. How to create health savings accounts using the same monies that we use to buy, you know, exorbitantly expensive health insurance. So that's just a matter of putting the pieces together. And once that is done, you know, all you need then is your catastrophic health care, which is going to be much, much cheaper. You know, the models are multiple. They will be worked out. It will be very easy for people to understand. And 80% of your encounters with the healthcare system are going to be between you and the system, not some third-party individual.
Yeah. You know, one of the interesting things, I know this doctor in Wichita, Kansas, he actually set up his own cooperative, and he buys medicines in bulk. He is available, him and his team, 24/7 for everybody in the cooperative. They all save money. They all get better care. They all get cheaper medicines. You know, do you think you'd be able to institutionalize that all around the country or something similar?
Well, similar things, because, of course, if the relationship is between the patient and the healthcare provider, you're going to bring the whole medical system into the free market. And free market forces will control cost and quality. It'll be much better in both of those instances.
Yeah. All right. Will you take a position if asked? Health and Human Services Secretary, Surgeon General, would you take those positions if asked? And have you been asked to take a position?
We're discussing these things. You know, I personally feel that you can do a lot from outside, but if that were the only way that it could be done, you know, obviously I'm going to do what needs to be done to assist.
So in other words, so you have discussed it. You can say it. It's okay. You can share it with me.
Yes, there have been discussions.
I happen to think it's a good choice myself. So you don't have to sell me on you, Dr. Carson. I'm a fan. All right. This is going to be a difficult transition, but one that's necessary before this thing totally blows up, which it's kind of imploding now of its own weight. Dr. Carson, thanks for being with us.
It's not going to be so difficult because it's going to be logical.
That's true. By the way, that's refreshing for Washington. Good to see you. Thank you, Dr. Carson.